7:32 is your time. This weekend marked the 3-year anniversary of the World Health Organization declaring COVID-19 a pandemic. Joining me now is infectious diseases physician Dr. Zain Chagla as we reflect on what we've learned and how the virus has changed. Good morning, doctor. How are you?
Good. How are you? Good morning.
I'm good. Thanks so much for joining us. Let's start right when it comes to the lessons we've learned. What are our big takeaways?
Yeah, I think there is a lot of celebration in the fact that we've been able to adapt very quickly to a novel pathogen, that, society has come together, healthcare systems have come together, and an incredible amount of biomedical research has really changed the disease that showed up 3 years ago to a disease that is largely, gone through most of the population without that much consequence. So, I think we can be congratulated on that. But at the same time, I think we also learned, and very early on, that this was a disease based on social networks that disproportionately affected people that had to be out, and people that had to work, people that couldn't stay home and flatten the curve. They were the ones that were disproportionately affected. And I think in future learnings, we really have to integrate that as part of our pandemic strategy.
So how would you right now classify the status of COVID-19 and the spread of the virus?
So, the virus is still circulating. Thankfully, even with viral evolution and the new XBB variant, it hasn't really led to a health systems destabilization. If anything, hospitalizations for COVID-19 in Ontario are lower than they were a couple of months ago. There are still populations being affected. And I think we have to still recognize this. We have great vaccines, we have therapeutics, but we still need to make sure that they're equitably distributed to those high-risk populations, people who are immunocompromised, people with multiple medical conditions, people who are elderly, again, the risks can be mitigated by an effective strategy, but it's almost time to double down on them because they're the ones that are being overrepresented in healthcare currently.
Throughout the pandemic, we've been chatting about masks and vaccines. They've become a daily part of our conversations. What changing behaviors have you seen there not only when it comes to behaviors, but also conversations?
Yeah, I think obviously masking and had its role, and I think it was an important intervention, especially at the time where we really didn't have anything else to offer to the population in that sense. Vaccinations have been incredibly effective and really have changed the face of this disease so that people met this virus when they had immunity to this virus and didn't suffer the consequences that we saw in 2020. But we are seeing, things drop off. This is normal. Even in mask trials, we see that a lot of people eventually stop wearing their mask. And I think that's just normal human behavior. We're also seeing vaccines drop off. And again, some of that is the fact that many people have been infected and may not know the reasoning to get another vaccine. And so, I think as we go into the future, we really do have to make sure that we, again, protect our high-risk populations, but at the same time recognize that people are fatigued, people are really wanting to go back to normal, and we do have to give them the freedom to do that, recognizing that there are tools that can help protect people and just educating around that.
What advice do you have for people who, a lot of our city or country, mostly everything is open? What advice do you have for people to navigate this new world, sort of?
Yeah, people have to look at their own values and needs and the people around them, their risks and what they want to do. Look, if people are at risk, we still have highly effective vaccines, including bivalent vaccines. If people are at risk, they need to still consider testing when they have symptoms because it's a pathway to treatment. But I think at this point in time, this is a disease that will be with us for the foreseeable future, and people have to navigate how they want to do that based on the risks and values, like we do with other diseases like influenza and other respiratory infections that we see normally.
Perfect. Okay. Infectious diseases physician Dr. Zain Chagla, thanks so much for joining us this morning.
No problem. All the best.